Thank you so much for attending this symposium this afternoon. We are going to share with you the role of Profilo in regenerative aesthetic medicine. I'm Dr. Lambilan, and I've been practicing aesthetic medicine for more than 20 years in Singapore. And we have Dr. Vincent Wong, all the way from UK. He just shared with me he took a 12-hour flight. Yes. That's a long way to join us here. And Dr. Wong needs no introduction. He's a very famous speaker and a researcher in UK. He has published many clinical papers. And of course, we have our very own dear Dr. Casey, who will be demonstrating to us the injection of Profilo on the face, the temple, and the forehead. Now, these are the contents of our talk. We have a very tight schedule, so I have to start very quickly. Now, we know patients are different today, and their needs are evolving. In fact, patients are progressively moving away from using derma fillers, using aesthetic treatments to correct visible signs of aging. Then they move towards using treatments to do refinements and treatments on the face for natural occurring outcome. Then they start to focus on improvement of skin quality. And today, patients are looking for regenerative aesthetic treatments to stimulate our skin to produce its own collagen and elastin. Now, as the patient's needs are evolving, so must our role as doctors and our clinical practice. In fact, clinical practice are evolving, and I'm sure Vincent will agree with me. Gone are the days we use derma fillers to correct lines and wrinkles, to give global volume replacements, where we inject 6, 8, 10, 12, 16 bars of fillers. We move again towards refinement and treatments. And then we also start to focus on improvement of skin quality. And today, everyone is jumping onto the bandwagon to talk about regenerative aesthetic treatments, to rejuvenate, to regenerate, to restore, and to repair tissues that are damaged as a result of aging. So what exactly is regenerative medicine? Now, regenerative medicine is the field of medicine that focuses on the repair and restoration of tissues that are damaged either because of aging, because of diseases, because of trauma, or because of congenital issues. And regenerative aesthetic treatments is the branch of regenerative medicine that focuses on the repair and restoration of tissues that are damaged because of aging. And regenerative aesthetic medicine intervention leads to cell renewal, revitalizing cells, and skin function. It also leads to tissue restoration, rebuilding structure, rebuilding volume. Now, IBSA came up with not one, but 3 innovative products through the patented Nihiko technology with very powerful bioremodeling and regenerative properties. In fact, in 2015, IBSA first developed the first game changer, Profilo 64, which I understand was being developed, was being launched in Thailand 1.5 years ago. It was available in Singapore in 2019, and I believe in UK since?
I think it's 2018.
2018?
Even before.
2018?
Yeah, before that. Yeah.
Even before that, yeah, I believe that. Okay, so it is a game changer because Profilo 64 is intended to be injected into the deep dermis to improve skin laxity, to deliver deep skin hydration for the skin on the face and the neck. Then in 2021, IBSA went one step further to develop Profilo Body to fill the gap in the body market to improve body skin laxity. For example, laxity on the inner arms, the elbows, the knees, and even abdominal skin laxity. Then in 2024, IBSA developed the next blockbuster, the next game changer, which Vincent agreed with me this morning, Profilo Structura. The Profilo Structura, in fact, is the first and only injectable in the market that is intended and indicated for adipose tissue restoration and adipose tissue repositioning. Now, it gives structural support to the adipose tissue. It is able to increase the tonicity. It is able to increase its firmness, and it results in tightening of the jawline, submental neck laxity, malar and submalar region. To me, in fact, it is an excellent product when combined with Profilo 64. Now, Profilo is able to do all that, okay? It's able to stimulate keratinocytes in the epidermis, fibroblasts in the dermis, increasing the production of collagen type 1, 3, 4, 7, and elastin. It is also able to increase the differentiation and proliferation of adipocyte stem cells. And it does this, most importantly, without causing any inflammation, without causing any fibrosis, through a normal physiological pathway. It does this by improving the ECM, thereby improving the homeostasis of the different cell type in our tissues. Don't believe what I say, okay? Dr. Vincent Wong is going to share with us the solid science behind Profilo. Vincent, the stage is yours.
Thank you so much, Dr. Lam. Thank you. Okay, good afternoon, everyone, and thank you so much for joining this session today. So before we begin, can I have a quick show of hands if you're already using Profilo in your clinic? Okay, quite a few. That's amazing. Right, I'm going to start with sharing a story of one of my very first patients I treated with Profilo. So many years ago, one fine afternoon, back in 2018, this patient came to me and she told me, "Doctor, I've just turned 70. You know, I don't want to look younger, I don't look any different, but I just want to look less tired." And then I looked at her face and I was just like, okay, tell me a little bit more, you know, what has brought this on? And then she told me that, you know, people have been asking her whether she's feeling unwell or whether she's stressed, even when she's feeling perfectly fine. And she has changed her makeup, her skincare to the most expensive thing we can imagine, and she has changed her lifestyle as well. But when she looks in the mirror, something is missing and she can't quite figure out what it was. So then we did a facial assessment and we decided that we would perform Profilo treatment. So 5 injection points per site, so 10 injection points in total. Took me 5 minutes to do. She left my clinic looking exactly the same, maybe a little bit worse because of injection points. And then she came back 4 weeks later, same thing again, in, out, super quick procedure. And then 8 weeks after that, she came back and she was smiling from ear to ear. And this was how she looked. Obviously, we can see a good improvement in skin quality, but that wasn't the reason why she was smiling so much. She told me, "Doctor, my friends have stopped asking me whether I'm unwell or I'm stressed. In fact, they've commented on how well I look, and they couldn't figure out why." And just like that, the penny dropped for me. The best aesthetic transformations are not usually the best before-afters, but results that patients can feel. And that, for me, is one of the beauty of Profilo because it provides results that patients can see and feel. So let's have a look at NACO technology. So we're going to explore the science behind it and the idea behind it in the next few minutes. So Profilo harnesses the power of hyaluronic acid, a molecule that we're also familiar with, right? So this is a new product, a new way of using hyaluronic acid in the regenerative aesthetic space. And I want to take your attention to 3 things. 1 is the concentration, and 2nd is the composition, and 3 is the rheology. Because we understand the concentration and composition, we understand the technology behind the product. And we understand the composition and rheology, we know the mechanism of action. By knowing all 3, we know exactly the type of clinical outcome that we can get in our clinic. So let's quickly move on to concentration. So typically, injectable hyaluronic acid comes in the form of filler, right? And the maximum concentration that you can get in 1 syringe is 26 milligrams per ml. And this is due to the cross-linking the viscoelasticity of the product. With the NACO technology, we are able to create this HCC, hybrid cooperative complex, which is unique to Profilo, where it breaks the concentration and increases it to 32 milligrams per ml. And in each session, we're injecting 2 ml, so we're actually injecting 64 milligrams of hyaluronic acid into the patient. Next, not all hyaluronic acids are the same, okay? So at a low molecular weight, it actually creates an inflammatory response. As you can see here, as the molecular weight increases, it becomes anti-inflammatory and it also has biorevitalization effect. And the 2 that are circled are the molecular weight found in Profilo. As you can see, they are both powerful antioxidants, really strong protective effects on the tissue, and they stimulate wound healing as well. Now, this is the technology behind the NACO technology. So we already established that we have two molecular weight of HA, so low and high, but it's not just a mix, okay? And it's not cross-linked with chemicals. So there's no chemical agent, no BDDE. Everything is processed using just heat. So here, as you can see, this is the second phase. So the thermal process will break the existing bond between the low molecular weight and high molecular weight chain, so they form new bonds in the middle. And then this is phase 3, where we cool the temperature down, and this is what forms a HCC, okay? So this is how Profilo works. As you can see, as we finish, it becomes a very stable structure, and it is also resistant to endogenous hyaluronidase. Now, we've covered composition, concentration. Now have a look at rheology. So I'm sure you're all familiar with G prime. So G prime is the ability of the gel to maintain its shape from external forces. So the higher the G prime, the more solid the gel is. And the next thing we want to look at is 10 delta. So 10 delta is a measure of how fluid the gel is, so the flowability of it. So if we want something that behaves like a liquid, we want the 10 delta to be more than 1. So as you can see here, let me go back. Okay. So as you can see here, for example, if we want a volumizing hyaluronic acid, we want something with high G prime so that it can give the lifting capacity, and low 10 delta so it stays where we want it to be. So that composition is ideal for a filler. But for Profilo, we don't want it to give any lifting, so you can see that the G prime is very low, but we want it to flow, to spread to other areas. So the 10 delta is very high, 1.36. And this is just a video to show, hang on, wait. So there's just a video here to show.
Okay, let me play it. Yeah.
There we go. Yeah.
All right.
So normal filler, once you inject it, it stays where it is. With Profilo, you can see it just glides down the plane. Okay, so it's very liquid, very fluid, and that's exactly why you want it to spread across the face. So as we saw earlier in the video, the formed HCC complexes are very stable. They are resistant to endogenous hyaluronidase. So in the tissue, it actually behaves a little bit like a slightly cross-linked filler with a higher concentration and more fluid. Okay, so with this, it allows the hyaluronic acid, the HCC complex, to have a prolonged action and better tissue integration as well. And what we find is that even though we inject in the dermis layer, we see improvement in the epidermis above and the hypodermis below. So there are many studies over the last few years on Profilo, and this you can see on PubMed or any other kind of like search engines that you use. And just in the last years, over 50 published articles have been published by different physicians in different countries across the world. But now we're going to have a quick look at what makes Profilo unique. And in order to understand this question, we need to go all the way back to the in vitro studies first. So, Profilo is a regenerative aesthetic tool that we can have in our clinic. And in order for it to be effective, it needs to work on the cells. So we're looking at the concentration and the quality of the extracellular matrix, and also the vitality of the cells. So what we want to look at is the impact on keratinocytes and fibroblasts, because these are the cells that produce collagen and elastin. So it's not just about collagen production, but also about elastin as well. As you can see here in this graph, with Profilo, the gene expression for collagen production and elastin production are increased by at least 12 times. And then this is a study on wound healing. So here, the highlighted area is with Profilo. Here we have high concentration, high molecular weight hyaluronic acid, low molecular weight hyaluronic acid. And what you can see is that the wound healing is actually much faster with the HCC. So if you look at what we can achieve in 24 hours, in the control, it takes 48 hours, okay? And what we can achieve here in 24 hours, again, with high concentration, it takes 48 hours to achieve the same result, all right? And this shows that, Profilo has a really good role and good potential in the regenerative space. Now, apart from keratinocytes and fibroblasts, we also want to look at whether it has any impact on stem cell recruitment and differentiation in the adipose tissue. And again, we compared it to high molecular weight HA, low molecular HA, high and medium cross-link HA as well. As you can see here, the results that we can get with HCC is unparalleled in comparison to other things that we've measured against. So this publication actually, or the results from this, actually is very important in part of the development of Profilo Structura, which is the next game changer from IBSA. Now, here I'm going to showcase to you, this is a preview of an upcoming study that will be published this year. So here we are comparing Profilo with a combination of hyaluronic acid and CAHA, PLA, and also saline solution as a control. So these are studies done on mice, and we did 2 injections 15 days apart, and the reason for that is because mice have higher metabolism rates, so they break it down a lot faster than human, all right? So we did 2 sessions with the exception of CAHA and hyaluronic acid because of the volumizing effect of this mixture. So after 15 days, and then we wait until day 60, we did a bit of skin sampling, and then we did histological analysis, all right? And what we found is that so everything was stained with the Van Giesen staining, so it shows the elastic fibers of the tissue, all right? So when you see this pictures, anything with the yellow arrow is elastin fibers. And here we have the results, okay? So this is hyaluronic acid and CAHA. This is polylactic acid. This is control of just saline. And this is Profilo, okay? So as you can imagine, the results are much better in the Profilo group. And this is very unique because everyone else is talking about collagen. But here we're looking at elastin, okay? Now, if you look at, again, some of the papers I mentioned earlier, over 50 papers in the last years, most of them are within the Caucasian population, but we're in Asia. So I'm going to highlight 3 different studies on Asian population. So the first one is a study on Chinese patients, so 28 patients in total, looking at Profilo for face and neck. And what you can see is that the results keeps improving, okay, from day 0 to day 60, and they have really good results in the neck area, so improvement in skin laxity, firmness, and tone, okay? And then another study done in Japan, again, 14 patients, and you can see similar results. After 90 days, the results just keep improving, right? So you can see the results here, really good improvement in the skin laxity and firmness. And then we also have a study from our very own Dr. Lam, who looked at patients from Malaysia, Singapore, and Indonesia. And once again, you can see really good improvement as the time goes on, all right? And what we can now say from all these 3 studies is that it doesn't matter how old your patient is. It doesn't matter what their background is. It doesn't matter whether they're male or female. It doesn't matter how bad or how good their skin quality is. They will see and feel the results of Profilo. And as a clinician, obviously, patient safety is also very important. So it's the most paramount thing in our clinical practice. And here we can see that over a 5-year period from 2018 to 2023, over 1 million procedures with Profilo were carried out, and a further 27,000 on the body. And bear in mind, this also includes the COVID period. So I suspect in a normal 5-year period, the number would actually be a lot higher. And the proportion of adverse events is actually very low, between 0.026 to 0.05. And amongst them, the most common one are swelling and a little bit of redness, which is what we expect. So we know that this product works amazingly well and is very safe for our patients as well. So now, I'm going to pass the stage back to Dr. Lam.
Thank you so much.
No problem.
Dr. Vincent. Now, after listening to the solid science behind Profilo, now let's talk about injection technique. A brief recap on what Vincent has presented. Now we know Profilo 64 contains 32 milligram of low molecular VHA between 80 to 100 kilodalton and 32 milligram of high molecular VHA between 1,100 and 1,400 kilodalton. And we know the function of the HA varies according to its molecular weight. As he's mentioned just now, a molecular weight between 80 to 100, it starts to have wound healing property, and it starts to have antioxidant property. Molecular weight in excess of 1,000 kilodalton, the HA starts to have very potent anti-inflammatory property, biorevitalizing property, wound healing property, and also antioxidant property. So why don't we just have a product with a single linear high molecular weight HA? This is because the high and low molecular weight HA in Profhilo protects each other from the degradation process of the hyaluronidase, and that what he has mentioned, it gives Profhilo the same duration of action as a low cross-link HA filler, like Alexion SR, that is also another SKU from IBSA. The rheology, another unique characteristic of Profhilo, 10 delta 1.36, and we know that 10 delta measures the flowability of the gel. A 10 delta of more than 1 means that it behaves like a liquid. The rheological property of Profhilo, G prime of 39, 10 delta 1.36, means it is intended to be injected into the deep dermis, where Profhilo will flow and results in improvement in skin laxity, improvement in skin hydration, so you don't have to worry. You inject the 10 BEP injection point at the correct plane, correct place, and you leave Profhilo to do its job of improving the skin laxity. Now, protocol, 2 sessions, 4 weeks apart. Bring the patient back 3 to 4 months later. You can do another session. Now, this is not recommended by the company, but in my own clinical practice, I will do 3 sessions, 4 weeks interval, because I feel that it gives my patient better results. These are the 10 BEP injection point on the face. I won't bore you with them. Okay, you can take a picture of this. Suffice to say that for this point on the zygomatic prominence, now Asian patients, we are very prone to having malar mound and malar edema. Now for this point, move it to the lower border of the zygomatic arch. This is to prevent the inadvertent injection of Profhilo, which contains 64 milligram of pure HA into the malar mound, accentuating malar edema. And trust me, your patients will be happy with you when that happens. Now, this is a 3D quantifier image showing the easy flowability and spreadability of Profhilo. You know the characteristic 10 delta or more than 1. Within 15 minutes after injection, it flows from the injection point to the rest of the face in the malar and submalar region. So some doctors ask me, can I perform 20 injection point or 40 injection point? You can, but there's no need, because you know Profhilo will flow and do its job because of the unique characteristic of Profhilo. This is my clinical cases. My first patient is a lady in her 20s. You can see even though she's very young, she already has a little bit of sagginess in the lower face and nasolabial fold. We do this as prejuvenation technique to prophylactically delay the process of aging. This is how she looked after 1 session. Second session, you can see a tightening of the jawline, malar, submalar region, and improvement in the skin quality, which is better reflected in the profile view of the patient. Take a look at this tightening of the jawline, a lifting of the cheek architecture as light is reflected off her face. Beautiful results, natural results that everyone notices, but nobody knows. Exactly like what Dr. Vincent Wong has shared with us, it is something that the patients love. Again, the other side of the face, take a look at the tightening of the malar and submalar region, the healthy skin look, which is what all of us want to achieve. Another patient, many of us will know her, a lady in her 30s who has been suffering from chronic eczema for many, many years. And this is how she looked after 1 session of Profhilo to the face and the neck. After second session, take a look at the improvements in the scaliness and the flakiness of the skin due to the chronic eczema. You can see here a tightening the jawline, malar, submalar region. The chronic scratching due to the eczema resulted in hyperpigmentation, and the skin brightens with every injection of Profhilo to the face and the neck. Why? How does this work? As I've mentioned, understanding the solid science behind Profhilo is very important, and Dr. Vincent Wong did an excellent job. You understand that Profhilo has potent anti-inflammatory property, potent biorevitalizing property, potent wound healing property, and that's why it can deliver such beautiful results to your patients. Now, this is a video, excellent video, which I want to share with all of you. demonstrating the improvement in skin elasticity, now proven in an in vivo study by IBSA, and improvement in the skin laxity by the pinch test. I always say this is the best tool, and it's free of charge that you can bring around in your clinical practice, the pinch test. All right? We can see after injection of the Profilo, there is an increase in resistance to the pinch test. I always do this in my clinical practice. Before I inject, I'll pinch the patient's face and show them. Then after 1 to 2 sessions, I'll pinch the face again and show them the improvement in the skin elasticity as evidenced by the increased resistance to the pinch test. Of course, some patients are very naughty. They will say, no, my skin already looked like this before you start the Profilo. So what I do, I ask them to hold a mirror and I'll start to pinch the skin on the neck. I say, no, your face, the skin on the face was looking like this, and that's how I actually convince them to do Profilo on the neck. I even pinch the skin on the forehead and the temple. All right, you notice with patients with a lot of skin laxity on the forehead and the temple, when you pinch it, the skin will take a while to return to its original shape. And that's how I convince patients to do it for the forehead and the temple. Now, we always say this is your first phase, this is your second phase, and this is your third phase. The skin on the neck and the skin on the back of the hands are two of the most over-neglected and underappreciated areas of your body. Do you agree with me? Now, and it is the two places that actually tells your age. We often take care of our face, but not the skin on the neck and the hands. Now, when your skin on the back of the hands is not so nice, even you wear the biggest diamond, they're not going to shine so bright, okay? And Profilo is excellent to treat skin laxity on the neck. Excellent treatment, 5 minutes, 10 minutes, and it's done. You probably spend 5 minutes injecting and 10 minutes talking to your patient because they're going to say, oh, you charged me $1,000 and you only perform the treatment for 5 minutes, okay? It's such an easy procedure to perform. The 10 BEP injection point you can see just now, I won't bore you with them. Now again, a 3D quantifier image showing the easy flowability and spreadability of Profilo due to the high 10 delta of more than 1. I won't be showing this video due to time constraint. If you are interested, you can approach me after this talk. I can share them with you later. Now this is the IBSA Neck Skin Laxity Scale, developed by IBSA, of course, and published in 2021. Now I feel that this scale is an excellent tool for you to initiate a conversation with the patients, to actually monitor, to evaluate neck skin laxity improvement after treatment with Profilo. For example, your patient comes to you with a grade 3 skin neck laxity. After 2 sessions of Profilo, it becomes a grade 2. You can tell the patients there's a 1 grade improvement. And if you want further improvement to a grade 1, you may need another 2, 3 sessions of Profilo. And if a patient comes to me with a grade 5 skin neck laxity scale, you can see in this neck, there is severe skin neck laxity, there is horizontal necklaces, there is also vertical platysmal neck bands. If you're going to tell the patient, do 3 sessions of Profilo, and I'll get you from this to this, or even this, your patient is going to be very, very disappointed. Why? Because we know the vertical platysmal neck bands are due to hyperactivity of the platysmal muscles, and they need treatment with botulinum toxin injections. That's why I always say this in my presentation: what you tell the patient before you start the treatment is considered a consultation. If you tell the patient, I'm sorry, after 3 sessions of Profilo, I can't bring you to grade 3 because you need botulinum toxin injection, they're going to be very, very unhappy with you. All right, so managing a patient's expectation is very, very important. And in my clinical practice, I always combine energy-based devices with Profilo because we know energy-based devices like our Therapy Prime, Thermarch, Morpheus 8 only treat the lateral aspects of the neck. We can't treat the center part because of the thyroid gland. And when you combine Profilo, I will do it same sitting. Immediately after the energy-based device, I wait 30 minutes and I perform Profilo on the neck. You will achieve excellent results, okay? The combination of the 2 treatments are synergistic. Okay, this is my patient, a lady in her late 60s. We can see she has significant laxity of the skin on her face, significant nasolabial fold marionette line, and also a grade 4 to 5 skin neck laxity. This is how she looked after one session of Profilo to the face and the neck. After second session, third session, we bring them side by side. You can see beautiful results, a tightening of the malar submalar region, the jawline, improvement in the nasolabial fold, marionette line, and take a look at this improvement. Now, this is skin neck laxity. You need to manage a patient's expectations because horizontal necklines can be softened by Profilo, but you can't get rid of these horizontal necklines. They're congenital necklines, and you need combination treatment for this. And even then, most times you cannot completely get rid of them. Okay? Another patient with submental skin neck laxity. After 2 sessions of Profilo, a softening of the horizontal necklaces, an improvement in the skin brightness after injection, the profile view of the same patient, and another patient with improvement of the skin neck laxity, horizontal necklines, and the skin tone and skin quality. Now, again, a pinch test to illustrate the improvement in skin elasticity and the improvement in skin laxity after treatment with Profilo, and increase in resistance to the pinch test. Now, one of the potential limitations of repeated HA injections, we know it's actually the tolerance and the safety. Now, this study aimed to evaluate the safety of Profilo injections up to 7 times in a year, and all these patients are followed up to month 12 after the first injection at month 1. Now, the results show that the wrinkle severity rating scale and the facial volume loss scale show at least a 1-grade improvement after the first injection in terms of nasolabial fold, marionette line, and cheek ptosis. And these positive results maintained throughout the study. There were also very little serious adverse events, or there are no very serious adverse events. They all resolved without any complications. So the study shows that it is safe and tolerable to inject Profilo up to 7 times in a year. So if a patient asks you, can I keep injecting Profilo? You say, yeah, you can. You can inject up to 7 times in a year. It is shown in this study to be safe and tolerable. But my take is this: we need to make money, of course, but we need to be ethical. We need to practice ethical aesthetic medicine. So bring the patient back after 1 month, after the second or third session, reassess the patient to see if you need another session of Profilo. If you don't need, you can always perform an energy-based device like laser or monopolar radiofrequency or HIFU. Now, Profilo can also be used to treat the skin on the temple and the forehead and the perioral area. All these protocols have been developed by you and I and all of us here because as doctors, we are very innovative. As I always mention, once you understand the science behind Profilo, the rest, okay, you can actually use it to treat any part of your body. And because doctors start to use it to treat the skin on the temple and the forehead and the perioral area, so we collected these cases, we published the papers, and we show you the protocol. Okay, the correct plane of injection for the temple and the forehead is in layer 2, in the superficial subcutaneous fat layer. Obviously, the anatomy that you want to be careful of here will be the superficial temporal artery that lies in the temporal parietal fascia. There's also another branch of superficial temporal artery, the zygomedical orbital artery that lies along the hairline, also in the superficial temporal fascia. And this will then branch into the frontal branch in the forehead, parietal branch in the scalp. Obviously, we also have the supratrochlear and supraorbital vessels. These vessels arise from the supraorbital, supratrochlear foramen. It sits on the bone, about 1.5 to 2 centimeters above the superior orbital rim. It pierces the frontalis muscles, and it goes to layer 3 or layer 2, exactly where you're going to inject Profilo using a cannula. So you really have to be very careful when you're injecting Profilo in the temple and the forehead. Treat these areas with great respect, all right? You need to understand the anatomy, use the cannula as a tool to help you achieve good results for your patients, not as a weapon. be very gentle when you're treating this area. So you can take a picture of this. I won't run through everything because we're going to have Dr. Casey demonstrate to us how it's being done. You mark out the area to be injected. If you treat lidocaine, I advise you to do it because you will actually hydro-dissect the hypodermis, that you can introduce a cannula easily and also to minimize discomfort for the patient. You can inject about 0.6 mL of product in 3 tracks, linear retrograde, 0.2 in each track. And for the temple, likewise, you can infiltrate lidocaine, as you can see, and then you put in 0.4 mL of the product in the temple. I won't show you the video because we're going to be seeing it in the live demo after this. Now, this is before and after picture of the patient, a softening of the static lines of the forehead, a brightening of the skin. Another patient, again, you can see a softening of the static forehead lines, a brightening of the skin. Now, I always combine Profhilo forehead with botulinum toxin injections in patients like this with multiple rows of low-lying forehead lines, because you know you cannot treat forehead lines that is below half the forehead, because it's going to result in ptosis of the eyebrow, the eyelids, and it's going to result in visual obstruction. So I'll do the botulinum toxin injection for the forehead, bring the patient back 2 weeks later, and perform Profhilo to the forehead. Because of it being able to stimulate collagen and elastin, it's very good in softening static forehead lines. It also improves fine lines. And if you do it in the temple, it is also able to improve the lateral canthal lines, which I'm going to show later. Again, static lines improve. The skin quality is better. You can see in this profile view of the patients, the static lateral canthal lines has been improved. In fact, I use Profhilo to treat my patients, very few of them, who are resistant to botulinum toxin injections. I will inject in the crow's feet area to actually soften the static lines, to also improve the fine lines. It is also good for patients who are very, very resistant, not because they're resistant to the toxin, they're resistant to injecting toxin in their faces, because Profhilo gives you very, very natural results. This is a study conducted by Dr. Daniel. I'm running short of time. Basically, to show you, the patients are injected with Profhilo in the temple and forehead. 10 patients, 7 females, 3 males. You can see here at day 150, 89% of patients reported that the skin firmness either improved or much improved, and 100% of patients reported the skin brightness, appearance, and the overall appearance of the treated areas has 100% improvement. A perioral area, again, Casey is going to demonstrate this. I'm going to run through very quickly. You can use it to improve the accordion line or the skin quality in the perioral area. Take a look at the softening of the nasolabial fold. Okay, an improvement in the barcodes in the perioral area, improvement in the skin quality. I think this result is much better than injecting, for me at least. I don't really perform lip flip with botulinum toxin because I find the patients sometimes smile weird. So with this, I think the results are much better and more natural. Again, improvement in the barcodes. Now, from the auditorium, we're now going to move over to Casey. Casey, are you ready? And she's going to demonstrate to us how to inject Profhilo in the face, the temple, and the forehead. Over to you, Casey. We can't hear you. Can someone put on the volume over the hospital in the clinic?
Hello.
Yes, we can hear you now, Casey.
Okay, thank you very much, Dr. Lam, for your excellent lecture. Since we are running out of time, I have already inject the xylocaine for the patient and also planned the injection points according to what Dr. Lam has already shown you. And now we're going to move on to the live injection. All right. So the first one, this one is the first point of the BAP technique for the cheek, the one that Dr. Lam just shared, that in Asian patients, if you inject exactly 2 centimeters away from the lateral canthus, there is a high chance that you would create the mala puffiness the next day. So I move this point downward just a little bit. The point is to palpate the inferior border of the zygomatic body and inject not lower than that. So this is going to be my first injection point. I'm going to aim my injection plane at the deep dermis. I insert my needle, I lift to check the plane, I put it down, and then I slowly push the product inside, 0.2 ml per point. And as you can start to see the volume expansion in the area, all right? So this one is 0.2. Next is the injection point next to the nose wing. So you draw the line from the base of the ala towards the tragus. The other line is the imaginary line at the mid-pupillary line where these two lines cross. That is where you inject. Again, this area, the skin is slightly thicker than this area, so I'm going to aim my needle a little bit deeper so that I can reach the deep dermis area. I lift the needle to check the plane. When I am sure that I am intradermal, I inject 0.2 ml of the product.
Casey, how would we know?
Yes.
Maybe you want to tell the audience, the doctors in the audience, that you are in the
Yes.
deep dermis or the hypodermis. When you insert the needle into the skin and you lift the needle, what are we expected to see? The gray of the needle or the body of the needle?
I expect to see the body of the needle, not the gray of the needle. If I can see the metal color of the needle, that means I'm a little bit too superficial. My aim or my goal is so that when I lift the needle, I can see the vague shape of the needle and a little bit of a soft tissue covering the needle, and then I lower the needle and inject 0.2 ml.
Yeah, thank you.
And
Thank you for the
if
explanation.
I am truly intradermal, I'm supposed to see the volume expansion of the product as demonstrated in this injection point.
Yeah, I think if you're intradermal, you see the gray of the needle, nothing is going to happen to the patients. The bleb will just take longer to disappear, but it's going to be a little bit more
Correct.
painful for the patients. So make sure you see the body
I
of the
agree.
needle, but not the gray of the needle. Do you do the same thing in your clinical practice?
Absolutely, yes.
Now, the danger zone.
Actually, in my opinion, I don't think there's anything wrong if you inject a little bit too superficial because
exactly.
it's still safer than going a little bit too deep. That is just my
That's true.
opinion. So there is a little bit adjustment of the injection point, as you can see here, because originally, if we're going to inject the BAP technique, the fifth injection point is supposed to be at the shin area. But this injection point is going to be overlapping with the injection points for the perioral treatment. So in this case, can you smile, please? As you can see, she has slight, camera 3, please. Camera 3, please. Okay, smile. As you can see, she has a little bit of the accordion lines in this area. So I move this injection point that overlaps with the treatment plan for the perioral to this area so that I can treat the accordion lines for her.
Now, Vincent, would you like to comment on the vessels at the point in the preauricular area and also the points at the inferior border of the zygoma? Because we know when we do injectables, I cannot emphasize the importance of anatomy.
Absolutely.
So would you like to share with the audience?
Yeah, absolutely. So in that area, obviously, we have the facial artery that's, takes a very tortuous route towards the corner of the mouth, and at this area, it can also be quite superficial. So it's an area that we have to be very careful of. In certain kind of like vascular area, I sometimes also aspirate. I know some people like it, some people don't like it, but for me, it just gives me a bit more assurance that I'm not in a vessel if I aspirate. I normally do that for about 10, 15 seconds. And then as we move towards the lips, obviously, we have the superior inferior labial artery. Again, these are very, very superficial, so we have to be very careful in that. And then we also have, the transverse facial artery near the zygoma, but that's normally quite deep, so I'm not too worried about that.
Yes,
Yeah.
I think the take is that if you respect the anatomy, you respect the injection points, you inject in the deep dermis or hypodermis, you are relatively safe, not 100% safe, because even for the transverse facial artery that arises from the superficial temporal artery, you have the superior emerging branch in the preauricular area. It lies a bit deeper in the subcutaneous fat. Then it travels along the inferior border, but in very, very skinny patients, the transverse facial artery can be quite superficial. So just make sure that you are safe, especially in very, very skinny patients when you're injecting Profhilo along this area. Otherwise, we know major vessels are found in layer 4 and layer 3, but your injection plane here is in layer 2. So you are quite safe.
And do you use ultrasound in your practice, Dr. Lam?
Yes, I will do ultrasound when I'm injecting in more dangerous area, like the temple or the forehead, and we're going to go to that and discuss later.
Okay, cool.
Yes. Who here in the audience is ultrasound in your clinics? Can I have a show of hand? Very good. Yeah, I think it's an excellent tool to actually complement your practice. Yes, Casey, where are you now?
I am at the second injection point of the perioral area since we're running out of time. As you can see from my planning here that I plan to inject 10 points of 0.2 ml around the perioral area. We're going to finish one syringe of 2 ml for this area in the patient who have a little bit more problem at this area. But if your patient have less problem, you can reduce some of the injection point according to the patient's aging symptoms. So this injection point is going to help support the thinning of the soft tissue at the oral commissure and help with the marionette line of the upper part.
What kind of anesthesia did the patient do? Did she apply topical lidocaine,
Yes,
or
she
did
did
you
apply
give local?
topical. She did apply topical anesthesia before the injection. That's all.
Okay, that's very good. We can see she's very comfortable. You have a very good subject,
Yes.
I have to say, because this chin point can be quite uncomfortable.
Correct, especially for patient who has really active muscle around the chin area. When you inject into this area, there can be some resistance, and if you feel that there's more resistance in your patient, I really suggest that you push slower, because if you rush into finishing your injection point, it could be quite painful for the patient as well. All right, so I'm going to do only half of the perioral injection point because our time is limited. Otherwise, I wouldn't be able to show you the injection of the temple and the forehead. And as I already mentioned, I have already inject the xylocaine into the treated area.
Can we show the forehead and the temple? Are you going to
ขอดู
proceed? Yes.
หน้าผากกับขมับ
Yeah.
ค่ะ โอเค แค่นี้เลยค่ะ All right. So as you can see here, this is the superior border of the zygomatic arc as the lower border of the treated area. The lateral border of the treated area is in front of the hairline. The medial border is along the orbital rim. And this upper border is at the temporal crest itself. I'm going to enter from the zygomatic arc, and then I will inject 2 linear retrograde injection of 0.2 ml at the temporal area. You might notice a slight palish appearance of the skin because I have already injected the xylocaine to this area. So when I work with a cannula, I prefer to clean the skin wider so that when I work, I have a wider aseptic field for to work with. แล้วก็เตรียมอันนี้ไว้เลยค่ะ ขอบคุณค่ะ All right, I'm going to start with poking an entry point here. ดึงออกค่ะ
What size cannula are you using, Casey?
I'm using 22G cannula 50 millimeter.
Can you show
You're
and
supposed
tell
to
us?
find
Yeah.
a little bit of a resistance when you come up midway because there's the resistance around the area of the temporal septum, but you can pass through, as you can see that you can pass through without using excessive force so that your injection is quite gentle and comfortable for the patient. I'm going to start injecting 0.2 ml. I'm going to inject very slowly and pull my cannula back slowly as well. And I will stop injecting at least 0.5 centimeter before the entry point.
Now, I think there are 3 planes we can
Alright.
perform a safe injection in the temple. You agree with me, Vincent?
Yeah.
The first plane is in the subcutaneous plane, layer 2. The second plane is in the interfascia
Yeah.
plane. And then, of course, the third is on bone. Now, in this case, we are performing Profhilo injections in layer 2, the superficial subcutaneous plane. If you're doing Profhilo and you see any irregularities post-injection, do not worry. What did we just share? Profhilo has excellent flowability and spreadability and is very, very forgiving. So any irregularity you see in the temple and forehead, they will disappear in a few hours. The most is 1 to 2 days. And that is what makes Profhilo very unique. Do you agree with me?
Absolutely, yes.
Yes.
ก็แห้งค่ะ
So you can see already there's some irregularity in the temple. If you're performing another HA filler with cross-linker and there's irregularity, you do not massage it down, the patient is going to stay with the irregularity for longer
100%.
periods of time.
ค่ะ
So how much have you injected, Casey, for the temple?
0.2 ml per line, so the total of 0.4 at this area. And you might notice that I start working with the temple first so that when I finish the temple, I can clean all the markings and that I have a cleaner field where my cannula might contact the skin when I perform on the forehead. So I always work from the temple up. In this area, you need to be a little bit more careful with the entry point since we already use the temporal crest as the landmark for the upper body of the temporal area treatment. The entry point for the forehead treatment is going to be slightly medial to the temporal crest, and you should be a little bit careful where you poke because there are some veins in this area. And as you can see here, this is the area that I'm going to treat. I will inject 3 linear retrograde of 0.2 ml per each line.
Maybe Vincent, you want to talk a little bit about the anatomy of the vessels in the forehead.
In the forehead,
first.
yes, of course. So in the forehead, so if we look at from sort of like the eyebrows towards the hairline, so the vessels normally travel in a deeper plane, closer to the orbital rim, up towards the hairline, up to about a point of about 2 to 3 centimeters above the orbital rim, and then it becomes a lot more superficial. So when we're injecting in this area, we have to be super careful because we are in layer 2, where all the vessels are very superficial. And obviously here we have the supraorbital, supratrochlear. So as we cross the mid-pupillary line, the density of the vessels, the vascularity becomes more complex as well because they form a lot of anastomosis with each other.
Exactly.
Yeah.
So I think even though you're using a cannula, as I've mentioned, be gentle, like what Casey is doing. Do not force the cannula because you can actually penetrate or you can cannulate the vessels. As what Dr. Vincent has mentioned, you know, the vessels go up, it sits on the bone, about 2 centimeters or so above the superior orbital rim. It will pierce the frontalis muscles. It will sit on the muscle exactly in layer 2 where you're going to inject your Profhilo. So be very gentle. As we can see here, there's a lot of irregularities, but any irregularities you see on the forehead and the temple and the face, they're all going to disappear.
Yes, in real injection case, when I finish one side of the injection, I usually leave the irregularity as is and then move towards the other side. And by the time I finish injecting the other side, the irregularity will start to look smoother already. That's most of the time.
And I think that's a really important learning point as well because we're so used to using filler and we see irregularity, we massage it down. But this is a unique way of using hyaluronic acid and it's not a filler.
Yes, exactly. And as I've mentioned, really Profhilo is very forgiving.
Yeah.
Excellent for treating static forehead lines,
Right?
fine lines on the skin of the forehead and the temple. Beautiful demonstration. Thank you so much, Casey.
Thank you so much, Dr. Lam and Dr. Wong. Back to
Right.
you.
Yes. Let's give her a hand. Now,
Cool. All right.
we are going to now invite Dr. Wong to share with us on the independent cases using Profhilo to treat pathological skin conditions.
Thank you so much. So picking up back on what Dr. Lam was presenting before the live session, she presented a case of eczema where there's a lot of scratching and things like that. So if you look at the publications on Profhilo, you can also see a positive impact on pathological skin diseases, especially inflammatory skin diseases like psoriasis and eczema and acne as well. So now we're going to have a look at this study. So again, you can see that in comparison to high molecular weight and low molecular weight, Profhilo has a much lower activation of TGF beta, so therefore less inflammation. So it has an anti-inflammatory effect, as we mentioned at the beginning of the session. So this is a patient who had 2 sessions of Profhilo in the area of inflammation. So 3 months later, you can see really good improvement. And then this is a patient with psoriasis. So here you can actually inject the Profhilo in small amount along the border of the lesion and also intralesionally. So as you can see from baseline to 1 month after the second session, there's a huge improvement and it just keeps improving. So this is the gift that keeps giving. Okay, so
now,
take home messages.
Okay, we're on time. Now,
Yeah.
we come to the close of the symposium. We're going to do a brief summary of what has been shared earlier on. So, Vincent, would you like to share and recap on the innovative characteristics of Profhilo to our audience?
Perfect. So as I mentioned at the start, there are 3 things that we need to remember. So concentration, composition, and rheology. So we need to remember that the concentration of hyaluronic acid in Profhilo is the highest in the market, so 64 milligrams in 2 syringes, 32 milligrams per ml. And then the composition, you have high and medium weight molecular weight, so very anti-inflammatory. We are not using the very low molecular weight ones. And also number 3 is the rheological property. So very low G prime. We're not filler. We're not giving any volume, but high 10 delta. We want the product to spread to other areas.
Excellent. And I think for all of us physicians, I feel that Profhilo is an excellent product to inject into our patients via the 10 BEP injection point on the face and the neck. They are, the BEP injection point are proven to be safe and easy to perform in clinical studies, both in Caucasian and Asians. Most importantly, Profhilo, due to its powerful bioremodeling and regenerative properties, it gives our patients very, very natural and long-lasting results. Now, what about your patients, Vincent? What did they feedback to you about Profhilo?
So I have patients who love Profhilo and some who are a little bit skeptical to begin with, but after the second session, when we do the review 2 months later, everyone loves it. Everyone could see and feel an improvement. And what's really important is there's no inflammation and no fibrosis.
Exactly.
Yeah.
And I think, like what you have mentioned, it's a quick lunchtime procedure. They're in and out in 5 to 10 minutes.
Exactly.
And the results are natural. They're long-lasting. And we know that Profhilo is able to do that. As you've mentioned earlier, you want to recap on what Profhilo can do for the skin?
So we find that the expression of the gene expression for collagen type 1, type 3, and elastin are actually 12 times higher in Profhilo compared to high molecular weight and low molecular hyaluronic acid on their own. And also we find that if we inject in the adipocytes, so in the fat layer, we actually recruit and differentiate stem cells as well.
Exactly. And I think what's most important is that Profhilo is able to do it through a normal physiological pathway without causing any inflammation, without causing any fibrosis. And Profhilo is able to do it by improving the ECM homeostasis, and it also maintain and improve the viability of the different cell types, keratinocytes, fibroblasts, and the adipocytes. Now, what's exciting that's going to happen, I hope in Thailand soon, maybe by the end of this year or next year, is Profhilo Structura.
Absolutely.
We both agreed it's the next game changer. It is a blockbuster. Profhilo Structura is intended to be injected into the subcutaneous fat tissue, where it gives structural support to the adipose tissue. It improves the tonicity, it improves the firmness of the adipose tissue, and it gives you excellent tightening of the jawline, submental neck laxity, malar and submalar region. And in combination with Profhilo 64, you can truly result in multiple level tissue regeneration and tissue rejuvenation, giving our patients, most importantly, natural, long-lasting results.
Absolutely.
And with that, we thank you.
Thank you so much.
Thank you so much. All right, perfect, we're on time. Okay, if there's any question, you can actually catch Vincent or I off stage. We can answer your questions.